So this PowerPoint presentation is part 2 of the Introduction to Communication in Health and Social Care, Adults and Children and Young People, Early Years and Childcare. It's part of the Level 1 Introduction to Health, Social Care, Children and Young People settings and the Level 2 Dementia Awareness run by Plato Training. The aims and objectives of the session are to gain an overall understanding of how to adapt your style of communication to meet the needs, strengths and abilities of an individual with dementia to allow them to enjoy and live the best life they can. To understand how a person-centered approach may be used to encourage positive communication with individuals with dementia, and to understand the factors which can affect interactions with individuals with dementia. You will be using your workbook to answer the questions, and it's important that you look out for the green box on each of the slides, usually on the right hand side, to show you which question the slide relates to. It's important that you do share your own ideas when you're working through the PowerPoints. You can use the ideas, but expand, put them in your own words. They're here to guide with pointers, but sharing your own ideas, it demonstrates a more and stronger understanding of the content. And if you do wish to progress to the next level, it shows you're able to do wider reading and have an understanding of a topic that's up for the discussion. So we're going to start looking at the slides that relate to question number 1. And how may memory impairment affect the ability when using verbal language, which is communicating through speech? So our memories are quite amazing and they perform the most complex and challenging processes. Despite plenty of research, there is still no certainty about how or why memory works as it does. The most widely held view is that there are 3 important functions of memory. Number 1, encoding, and this means receiving and processing information. Number 2 is storage, and this is about keeping the information somewhere it can be found if needed. And number 3 is retrieval, so this is the process recalling information as and when it is needed. So in order to carry out these complex tasks, we all have different sorts of memory. So we've got sensory memory, we've got short-term memory, and we've got long-term memory. So sensory memory is a very short memory, and it's literally milliseconds, and we use it when we first see or hear something. It is this memory that means we can look at something and remember how it looks or what it sounds like. Short-term memory contains information that we can remember and recall short periods of time, usually up to half a minute. And long-term memory is infinite in size, and it can store and recall information over very long periods of time, sometimes over a whole lifetime. All memories stored for longer than 30 seconds are in the long-term memory. Unfortunately, different parts of the brain are affected during the process of dementia, and memory function is lost or reduced. Usually, short-term memory is affected most significantly, whereas people are able to recall many areas of long-term memory. Unfortunately, it's the short-term memory that is used to deal with experiences in the present. In order to hold a conversation, you have to be able to remember what has just been said so that you can reply. And in order to read a sentence in a book or a newspaper, you need to be able to remember the first part of the sentence to make sense of the ending. So an individual with dementia who has an impaired memory may be unable to share a conversation. They may be, they may not be able to laugh. They may not remember past experiences with friends, family or loved ones. However, individuals with dementia, they can often remember experiences from a long time ago, but not what they did yesterday. So it really does depend on the stage of the dementia and how that individual is. And finally, the development of dementia can damage the parts of the brain that remember the language we need to use and the right way to use it. It is important to recognise, though, that not all parts of the memory will be lost as dementia progresses, and memory will be lost at different rates. This means that people can be supported to adapt and use the memory function that they have in order to help them to communicate. So this brings us to question number 1. So outline how memory impairment may affect the ability of an individual with dementia to use verbal language. So it's level 2, remember the dementia. So we need to outline this answer. You need to demonstrate your understanding of the different parts of the memory and then show how the effects of memory loss can affect verbal language. So we're now going to look at a slide that relates to question number 2. And we're going to look at recognising an individual's communication strengths and abilities. Now, we have looked a little bit before about the person-centered approach, and it's about finding out that individual person's strengths and abilities. And we can do this through observations and documentation. So we would, discreetly observe them and monitor an individual with dementia, documenting their strengths and abilities when you're communicating, socializing, verbalizing, and generally interacting with others. You're watching them, you're looking to see what their strengths and abilities are. Then sharing your findings in a confidential manner with the team so they have a thorough understanding of how to meet the individual needs. And that's, it says you need to share those findings in a confidential manner. You're only going to share them with the appropriate people, and you're doing it in the best interest of that person, so that you can recognize what their their personal needs are. Spending time with the individual, the family, the friends, their loved ones. Gather as much information as you can from them on the individual's preferred method of communication. Offering accurate support and techniques and any aids, such as using picture cards, objects of reference such as hobbies, equipment, so sports and music, etc., photographs to reminisce of memories and past times, and one-to-one time enjoying activities with the individual to encourage communication and interaction. So question number 2 is asking you to explain how to identify the communication strengths and abilities of an individual with dementia. So think about the last slide, think about some of the ideas on there that's been discussed, but also do some research and look for some of your own ideas. And remember, it's a level 2, it's an explanation, so you need to write in sentences and provide paragraphs to answer the questions. So we're now going to look at the slides relating to question number 3, and we're going to, talk about understanding an individual's preferred method of communication and why it's important. So we're all different. We all have a style of communicating that is our usual way of interacting with the world around us. Some people are noisy and chatty, whilst others are quiet and calm. Some people are very tactile and they make a lot of physical contact with others, where some people don't use touch, they use touch very rarely. There are very mobile and active people that use different facial and body movements, such as waving their hands around, when they are communicating. And there are others that are very still and hardly move and have very little facial expressions, which, goes to show that we're all different. So it's very important that we understand individual's preferred method of communication, and it will allow you to be as effective as possible when communicating with an individual. It will also allow the individual to reinforce their identity and their uniqueness. And question number 3 is asking you to describe how to adapt the style of communication to meet the needs, the strengths and the abilities of an individual with dementia. So there's a tip on there. Look back at the answer to the previous question and think about what you will do with the information you have found out about the individuals with dementia. So we're now going to look at some slides relating to question number 4. And it can be quite easy to just see the illness of a person with dementia and all the aspects of their life just disappear because you're just focusing on the illness. The personality, their humour, their achievements, kindness and family life can be lost, again, because you're just focusing on the dementia. Working in a person-centered way recognizes people for who they are and that people are valued for who they are and all of the important things that they still are. And identity is what makes people who they are. Everyone has an image of themselves. It can be a positive image overall or a negative, but a great many factors contribute to a person's sense of identity. Think of your own identity for a few minutes. What is your identity? What image do you have of yourselves? And some of the factors that contribute to that, as it says on here: gender, race, language, religion, family, friends, culture, values and beliefs, sexuality. They're all part of your identity and the image that you have of yourselves. And all these factors of our lives contribute to the idea of who we are and our uniqueness. And looking at uniqueness, by recognizing everyone as unique, this is reinforced by knowing how they prefer to communicate and what their strengths and skills are. By asking others for information and taking time to find out about individual communication methods, you're putting them at the center of your practice. If individuals with dementia are communicated with using their preferred method of communication, they will feel more in control of their condition. The person caring for them will show they understand their individual needs, the symptoms, and how to react to the behaviours and actions. By having a good level of understanding of an individual's preferred method of communication will allow you to interact and promote familiar conversation and discuss likes, hobbies and interests, and this will promote as individuals their identity and uniqueness. Successful communication is positive for individuals with dementia because it will promote a calm atmosphere, making the individual feel less confused and comfortable in his or her environment. The individual will feel respected and understood, and it will reinforce their confidence, their identity, and their uniqueness. So you're now going to look at question number 4, and you're going to describe how information about an individual's preferred methods of communication can be used to reinforce their identity and uniqueness. Think about self-image and person-centered care and support. Think about what we've discussed on the last few slides to help you with your answer. So we're now going to look at question relating to question number 5, and we're going to look at how understanding an individual's biography and history can facilitate positive interactions. So by you knowing about that individual, you know their background, you know about their life, their history, it can make an individual feel familiar to the environment. It can make them feel safe. It makes them feel respected and valued because you know about them, you're valuing them and they feel respected. It promotes and can encourage conversation because you've got something to talk about, because you know about their history, you know about their lives. This can also often trigger specific memories of important and happy times in an individual's past life. So if you know about where they used to work, previous employment, when they got married, so their wedding day, holidays they've experienced and been on, birth of their own children. However, sometimes this can cause, it may show confusion because they can refer to their mother as their daughter, for example. The individual will reminisce of a specific event, but it may be difficult to accurately discuss and exchange information. This is where we as professionals and care workers, we must understand that the individual's history and biography so we can support them in sharing their stories and their experiences. We must also be aware of negative triggers. We must also be aware of the biography and history of an individual that they would not wish to reminisce over. You must be aware of topics to be avoided. This may trigger negativity and upset to the individual and maybe their family, friends, or loved ones. By having a good understanding of an individual's biography and history, it will allow you to plan activities that you know the individual will enjoy and familiarise with. This will promote interaction, socialisation, and communication, but also just bearing in mind and making sure that you do know what the negative triggers are, so that you don't upset that person. So question number 5 is asking you to explain how reading and understanding an individual's biography and their life history can help you to create positive communication and interactions. So remember to write in sentences and paragraphs for your answer. So we're going to look at things that relate to question number 6 now. So we're going to look at different techniques that can be used to facilitate positive interactions with an individual with dementia. So, for example, speak clearly and slowly. Listen accurately and don't interrupt. Give the individual time to respond to your questions. Use appropriate questioning and techniques, open or closed, depending on the individual. Use appropriate eye contact, body language and facial expressions so that person, they can understand what you're saying in different ways. Use appropriate tone and volume when speaking, again, specifically for the individual and the conversation you're having. Encourage the individual to share conversation with others. Make them feel included. Even if they're not verbally communicating, include them in the conversation. Don't stand over an individual, if they're the same height and level, kneel down, sit down so that they can actually see you. Don't invade an individual's personal space. Use objects for reference, picture cards, familiar objects, and that can simulate memory, and it can help the conversation to carry on. So question number 6 is asking you to list at least 4 different techniques that can be used to help to have a positive communication and interactions with an individual with dementia. At level 2, you need to show your understanding of each technique, so write a short sentence after each technique to show what it means. And you will see in the left-hand box in your workbook, you'll write the technique, and in the right-hand box, how it can help staff have positive communication and interactions with individuals with dementia. And it's asking for at least 4 different techniques. So we're now going to focus on the slides relating to question number 7, and we're going to look at how can involving others enhance interaction with an individual with dementia. Now, we've talked about multi-agency working on other sessions, and when we're working, when we're looking at people with dementia and working with them, there are other people, other agencies involved. So professionals. So we must ensure that all the correct agencies and professionals are involved in the individual's care. Professional help from a range of services aids the individual to be more in control of their symptoms, and they will receive expert intervention, care and support for the individual and also for the family of the individual, because they need support as well as the individual. So which professionals could help individuals with dementia to communicate? So for a few minutes, have a think about that before you move on to the next slide. So there's a wide range of professionals and care providers, including speech and language therapists, social workers, occupational therapists, GPs, physiotherapists. There's also pharmacists and nurses, psychologists, psychiatrists, independent mental capacity advocates, dementia care advisors, support workers. And by involving others, this will ensure that the individual will have the best possible professional support to manage their condition as effectively and possibly as and living a happy life as possible. There are also key workers. And key workers ensure that the staff caring for an individual with dementia have been accurately matched as their key worker. A good match as a key worker ensures that the individual with dementia will receive the best quality of care they deserve. If staff or others do not understand dementia, it can often cause the individual with dementia to become more confused, increasingly frustrated, and very agitated and low in mood. It is therefore important that all people working and/or caring for individuals with dementia have dementia awareness training. And question number 7 is asking you to explain how involving other professionals may improve interaction with an individual with dementia. To answer this question, you need to identify different professionals and say how they can help a person with dementia to communicate. So think about the slide we just discussed and also do your own research for the professionals that can help an individual with dementia. And now you've come to the end of the session. You should be able to gain an overall understanding of how to adapt your style of communication to meet the needs, strengths and abilities of an individual with dementia to allow them to enjoy and live the best life they can. You should understand how a person-centered approach may be used to encourage positive communication with individuals with dementia. And you should be able to understand the factors which can affect interactions with individuals with dementia.